The other issue that I want to mention, stroke is a preventable disease. It's actually one of the most preventable, devastating illness. And the risk factor for heart disease are the same risk factor for stroke, except one, which is an aneurysm in the brain, in the blood vessel, or a blockage of the blood vessel in the brain, okay, or certain disease that run in the family and can cause brain injury or brain damage. Okay. As I said to you, any risk factor for heart disease is the same. They are the same like the risk factor for stroke. Anybody who has high blood pressure, young, old, for whatever reason, they are at risk of having a stroke. And high blood pressure is the highest, or the most common risk for stroke. High blood pressure can be prevented with medication. Lots of younger people who check their blood pressure, it was found to be high, they check it again, their doctor tells them it's a borderline. Well, we'll talk about how we can prevent a borderline blood pressure, which is modification of lifestyle. You may not need medication, but you may need to change your lifestyle to decrease your risk for having persistent hypertension or high blood pressure that can cause you to have a stroke. People who has diabetes also, if they do not monitor their blood sugar repeatedly, they are at risk of damage of the blood vessel in the brain or in the heart or in other parts of the body. But these kind of risk factors such as diabetes put the people at risk of something we call it silent stroke, meaning they don't have any silent symptoms, but they have damage of the blood vessel in the brain. And these are the small blood vessels here. Okay. These are the small blood vessels, little tiny branches. They get thickening of the wall and the blockage of these blood vessels. These areas can cause, if there's a blockage of this area blood vessel, they will have what we call it lacunar infarction or small infarction. And they can have silent stroke. And the only presentation or the only symptom they may experience is progressive loss of memory. Some people, they were diagnosed with Alzheimer's, but they may not have Alzheimer's disease. They may have a small vessels disease that caused injury, tiny injury to different area of the brain, especially the area of the memory, and can cause them to have progressive memory loss and need to be checked for risk factor for stroke. Smoking, the same thing. Smoking is a very common risk factor for stroke because the same way it affects the heart, it affects the blood vessel in the legs, in the arm, and in the brain. But we really have to focus on the brain because the brain is a vital organ. Okay. And somebody who stopped smoking 10 years ago, only these people who stopped smoking 10 years ago, they come back to have a risk or equal risk for having a stroke as somebody who never stroked. So you have to stop smoking soon. Do not delay that. Okay. Talking about other risk factors, high cholesterol. High cholesterol can cause blockage of the blood vessel, as I mentioned, and as Dr. Fontanet explained to you that calcium and cholesterol deposit in the wall of the blood vessel will cause clot in the blood vessel. And unfortunately, and this is something different than in a patient with heart disease, somebody can have blockage of these blood vessels without having any signs and symptoms. Okay. They are, these blood vessels, if the blockage would progress, will cause blockage, complete blockage and occlusion, total blockage of the blood vessel. And then the whole area that's supplied by the specific blood vessel will not get enough blood. And at the time when they have the complete blockage, there will not be enough perfusion. There will be less and less oxygen and blood coming to that area, and that caused a brain injury and a stroke. Okay. We have the opportunity to decrease the risk of stroke for these specific patients who has asymptomatic asymptomatic blockage of the blood vessel by doing surgery, cleaning the clots. Okay? And this is a surgery that proven to be very effective in prevention of stroke. Exercise, lowering your blood cholesterol, lowering your blood sugar, quitting smoking, do not exceed in alcohol. Excessive alcohol intake proven to be one of the common risk factors for stroke. In younger people, migraine, especially in females, migraine is one of the risk factors for stroke. One study was done in France, showed that women under age 40 who has migraine are at higher risk of having a stroke than women who never had migraine. Talking under age 40. Okay. Migraine is not everybody has migraine can have a stroke, but there are certain risk factors also. If you add migraine plus high cholesterol, migraine plus smoking, all these additive risk factors will increase the person's risk of having a stroke. Again, there are medications that we use for migraine, and migraine, this is why, or this risk factor can be prevented or is prevented. Now, I want to discuss an important issue, which is the issue of injury. Okay, people can have injury and have a stroke from the injury itself. Okay, I had one patient who was doing an exercise in the gym, a college student. Okay, he was exceeding with exercise, lifting heavy weights. He developed sudden onset nausea and vomiting, and he had balance problem. He's young. We didn't think that he's having a stroke. We didn't think that this is something serious. He went home with his friend and relaxed. He got a little better. Next day, he couldn't put anything in his mouth. He started vomiting. He called his mom, said, well, I'm very sick. I need some help. His mom came to see him. He looked very ill. Okay. She took him to the emergency room. But he had injury. This vessel here, the vertebral artery, there's dissection in this vessel. The wall of the blood vessel injured. And that injury, there's clot developed here, and this clot went to the area where the balance and the nausea and the vomiting centers and caused him to have these symptoms. 21-year-old gentleman. So nobody is spared from stroke. Realizing the signs and symptoms, realizing stroke is an emergency is crucial, and we wanted to stress on that. The month of May is the National Stroke Awareness Month. And this is why we're really carrying this responsibility to educate and make people aware of stroke, of the signs and symptoms of stroke, and how to prevent it. Okay. Tampa General Hospital is serving the community to provide this awareness. We have an extensive research on stroke prevention, and we wanted to really carry this responsibility and try to provide an opportunity for people to screen themselves for these risk factors. On Thursday, the 16th, we are providing a stroke screening on Franklin Square Mall in the area here for screening for blood pressure, for blood sugar, for cholesterol, for other risk factors for stroke. And this is what we wanted to do. Some people, they don't ask their doctors about their risk factor. Please do. Okay. We wanted to be sure that all of us understand what their risk for stroke, if they have their family who had a stroke, or if they are themselves are at risk for stroke, they need to ask their doctors and need to work on this as soon as they can, because stroke is preventable. Stroke is a devastating illness. We need to carry on this responsibility, and we need to be sure that we're able to prevent stroke from happening. Thank you very much, and I appreciate that you're coming today. If you have any question, please feel free to ask.